You've taken an HIV test and your results were negative, but that doesn't mean that you don't have HIV because there's a window period. This is the time between exposure and when the test accurately detects it. If you get an HIV test within 3 months after possible exposure to HIV and the result is negative, take it again in 3 more months just to be sure. Your test result has nothing to do with your partner. HIV is not necessarily transmitted each time you have sex. Your test result is only for you. If you test positive, a follow up test will be conducted. And if that one is also positive, it means you are HIV positive. If you've tested positive for HIV, talk to your healthcare provider about taking medicines that treat the infection. If you take them every day, these medicines can keep you healthy for many years and reduce the chance of you transmitting it to others. HIV doesn't mean AIDS. AIDS is the most advanced stage of HIV disease, but it can lead to AIDS if not treated. This is why treatment is so important. If you've tested positive for HIV, you can lower the risk of transmitting it by taking medicines daily, using condoms, and encouraging your partner to see a healthcare provider to see if they should take medicine as well. It's recommended that everyone between the ages of 13 and 64 get tested for HIV at least once as part of routine healthcare. People at higher risk should be tested more frequently. You are at higher risk for HIV if you're a man who's had sex with another man. You've had sex with an HIV positive partner. You've had more than one partner since you were last tested. You've injected drugs or shared needles. You've exchanged sex for drugs or money. You've been diagnosed with or treated for another STD, as well as for hepatitis or tuberculosis. You've had sex with someone who fits into any of these categories, or you just don't know your partner's history. Get tested. Think about this with regard to your partner. They may not know their status, may be wrong about their status, or may not tell you if they have HIV, even if they know it. So you should get tested together so you both know your status. Typically, no one knows your test results but you. In anonymous testing, you get a unique identifier that ties you to your test. In confidential testing, your name is attached, but it goes to your healthcare provider and you're protected by federal and state privacy laws. Self tests are generally reliable, but they may not be able to detect recent HIV infections, so you should confirm them with follow up tests. This public service announcement was brought to you by the Central Jersey Alumni Chapter of Delta Sigma Theta Sorority, Incorporated.